Hello, I'm KaraBeth Moore. I am the head of the breast cancer program here at the Lexington Clinic and the breast surgeon. And today we're going to talk about lymphedema. Lymphedema is a condition that can develop where a protein-rich fluid develops between the fat cells in an extremity. And the extremity that I deal the most with is the upper extremity. Lymphedema has different causes. There's primary lymphedema, which is a congenital abnormality, but secondary lymphedema is what I deal with primarily. And during breast cancer treatment, women can become at risk for developing lymphedema because a lot of women have to have their lymph nodes evaluated in their breast cancer treatment. So I typically will remove 1 to dozens, depending on whether they need a sentinel lymph node biopsy or an axillary node dissection. And then if they then have to go on to get radiation, that increases their risk even further. So women that have treatment for breast cancer are at risk for developing lymphedema if they have a lymph node removed or if they receive radiation or sometimes chemotherapy. So the hope is that if we identify women that have subclinical lymphedema, we can then get them into treatment and rehab in order to prevent progression of their lymphedema. So if we can detect it in a subclinical way before they even develop symptoms, then hopefully we can prevent that from progressing to a point that it would be irreversible. Some of the first signs are very subtle. Women may complain of limb heaviness or maybe some change in sensation. And then even later, they'll develop swelling, sometimes in the hand, sometimes in the full arm. Once they develop swelling, though, that's way past where we really want to identify lymphedema. At Lexington Clinic, we wanted to develop a lymphedema program that would be able to screen women for lymphedema. So we purchased a bioimpedance machine that will detect subclinical lymphedema. So every woman that's getting breast cancer treatment that will be at risk, so if they are going to have a lymph node removed or radiation or chemotherapy, then they get a baseline score on this machine. And then each subsequent visit, so I see them every 3 months for the first year while they're going through their treatment, they will get another measurement. And if that measurement, it's called bioimpedance, and it's an L-Dex score. And if that increases to a certain amount, then that is a flag that they're developing subclinical lymphedema, and we can act quickly and get them into physical therapy to hopefully prevent that from progressing. And then we can then follow that after they've had physical therapy to see if that score is improving. This is a bioimpedance machine that can detect subclinical lymphedema. So when I remove a lymph node from your axilla, it puts you at risk of developing lymphedema. So this can detect subclinical lymphedema. So before you start having symptoms, we can hopefully detect that you're developing lymphedema. So the way we do this is you just stand on the machine, bare hands, bare feet, and it calculates a score, an L-Dex score. And then at each subsequent visit, we can remeasure you, and if that score increases a significant amount, then we know that you're becoming at risk for developing lymphedema, and we can then get you in to seek physical therapy and hopefully prevent that from progressing.
Hi, I'm Linda. I work at the Center for Breast Care with Dr. KaraBeth Moore. Today I'm going to go over how we do a lymphedema measurement with patients. So I upload their information, their demographics, their height, their weight. We bring them over to the machine. All patients have to have all jewelry off, along from the neck down, keys out of their pockets. We do wet the base of the machine for the lymphedema measurement. I have them stand up on the machine, bare feet on the bottom, hands on the top. I put their information in, finish their demographic, and this will calculate an L-Dex score for them. And it will tell us whether or not that patient is at risk for lymphedema after surgery.